everyone. So today we will be talking about vision assessment. The learning objectives of this lecture include that you should be able to tell the fundamental basis of visual acuity, the principles of visual acuity charts, the visual acuity notations. You should be able to calculate the letter size for different testing distances, and you must be able to understand the concept of pinhole and about the color vision at the end of the lecture. So rolling the lecture, vision assessment is very important because this is the primary complaint with which our patients come to us. They will either have a gradual or a progressive loss of visual acuity. The visual acuity loss would either be associated with pain or it would be painless. So to explore those other symptoms and signs, the basic lies in the vision assessment. So visual acuity, what does it really stand for? Is it just the notation that we read on the vision chart, or is it something more complex? It includes several parameters which include the light sense, the form sense. We have to be able to see the form of the object that we are looking at, the sense of contrast and the color sense. The word acuity is derived from equitas, which is a Latin word and means sharpness. So it includes the resolving power of the eye or the ability to see two separate objects as two distinct entities. Now, the normal visual acuity of the human eye for discriminating between point sources of light is 25 seconds of arc. Now, this can come as an MCQ question. You have to understand that there is a theory behind this concept of being able to distinguish two objects as two separate ones. At fovea, the cone's diameter is about 1.5 microns and the space between two cones is 0.5 microns. The effective separation that comes out between the center of two cones is 2 microns. If two adjacent objects fall on two adjacent cones, then they would appear to an eye as one object. For them to be distinctly seen as two objects, there has to be an intervening cone which is not getting involved in this process. So if the two images, they fall on two cones which are separated by an unilluminated cone, then the points of light would be perceived as two distinct sources. So for a resolution, we need an unstimulated cone in between. Now, there are several types by which we can assess visual acuity. The objective measurements, they include the 10 prism diopter fixation test, preferential looking test in children, optokinetic nystagmus test, Cat4 drum, galvanic skin response, and visual evoked potential. Now, children, unlike adults, cannot read a visual acuity chart, especially infants and toddlers. So, you have to find a way to assess their visual acuity. Because if we know what is the visual acuity of the child and if it's less, we have to address it well in time so as to prevent the onset of amblyopia. So, if we have a look at this image, your left hand side, a typical preferential looking setup would include presentation of two visual stimuli at the same time. The positive stimulus will have some sort of a grating or some sort of a pattern, and the negative stimulus will have a homogeneous area. As would be expected, a child would be more attracted towards a patterned image, and the logic is the same behind this test. So if an infant shows a reliable preference for a particular stimulus over the other, we know that the child is able to differentiate between the two stimuli. So this is a very easy test and can be done in the clinics even with small children. Out of all these, visual evoked potential is the most reliable and the most objective, and this can come as an MCQ question. There are several subjective tests which involve reading the charts. They include the Snellen's test types, the Landau's test types, tumbling E-chart, Allen picture chart, HOTV chart wherein only 4 letters are placed, H, O, T and V, Heidi, Steicar test, the Lighthouse test and the Sheridan-Gardiner test. Now there are several tests and there is none which is better than the other. So whatever is available to you and whatever your patient is responsive to is the best for your patient. So out of them, there is nothing which is better over the other. Then coming over to some more basic concepts, there is a concept of a visual angle. That's the angle which is subjected by an object at the retina. The important aspect of any stimulus or of any object that you are trying to see is the size of that stimulus. And there is a distinction that needs to be made between the size of that object in the real world and the size that this object will have on retina. The size of the object in the real world will be measured in terms of millimeters, inches or miles. But when we talk of retinal sizes, they are measured in terms of visual angle. Therefore, it is important to know the size of the object in terms of what we are perceiving in the retina, and the same would be communicated to our visual cortex. So, visual angle, it is incorporating the size of the object and its distance from the observer, and the formula for its calculation is object size divided by distance. So the brain's primary visual cortex, that's the Brodmann area 17, it contains a sort of a distorted map of retina, which is also called as retinotopy. And the size of the given retinal image determines the extent of the neural activity pattern, which will be eventually generated in area 17 by the associated retinal activity pattern. So whatever is communicated from the retina to the cortex, that is what is going to be perceived by an individual. So this retinotopy representation is very, very important when an object is being seen from the real world. Now, you will wonder what is the angle that is being subjected by objects that are very distant from us. And two such objects that we see day in and day out are moon and the sun. The visual angle subtended by the moon is 0.5 degrees and so is by the sun. But we know that the sun is much farther away from the moon. Then why is this happening? Even though the sun is farther away, its diameter is quite large, much more than the moon, and that compensates for the extra distance. And since the visual angles are the same, that's why we can still see a ring of sun behind the moon whenever there is a solar eclipse. So it's the distance from the observer and the size of the object that really makes a difference. Now there's another point that needs to be remembered, and that is the concept of nodal point. Nodal point, there are two nodal points in the eye. There is an incident nodal point and there is an emergent nodal point. When a ray of light passes through the incident nodal point and emerges from the system through the emergent nodal point, then its direction is not changed. That means at this point, there is no parallax that is happening. Because each of us and each of our eyes' optical system has some amount of astigmatism, we all do not have standard nodal points. So you cannot say that in our optical system, there is no parallax. There will be some amount of refractive error, there will be some amount of astigmatism, and therefore, most individuals do not have nodal points. The light pathway is not straight, we know that. The light has to pass through several curved structures. So the first structure that is encountered in the pathway of light that is being projected on the retina is the corneal tear film. After the corneal tear film, we have the convex surface of the cornea. Then the light passes through the anterior chamber. It has to cross the anterior lens surface, then the posterior lens surface, and then it gets to focus on the retina. If the secondary focal plane of this combined refracting elements is focused at the retina, then the eyes, they see well. The image that is formed is very crisp. And if not, then that means that there is a refractive error. There are several types of visual acuity. So whatever I have told you till now were the concepts which now will get incorporated when we talk about visual acuity. Usually we all know that whenever we go and get our eyes checked, we have to read a chart and a certain notation is given of the amount of letters that we have read. But that's not the only type of visual acuity that is there. The outcome, that is the refractive outcome, is dependent on several other elements of visual acuity. That means that the objects have to be minimally detectable. That means the objects have to be visible. There has to be a minimum separable distance between them. That is the resolution. They have to be minimally cognizable. That means they have to be recognizable. And there has to be a minimum discriminable distance. And that is called as hyperequity. So, if I have two lines which are slightly separated from each other, this angle that is forming here, I should be able to perceive this angle so that I can say these are two distinct lines. So, this is called as hyperequity.